Every mother wants to give birth safely. Where can she go for care when her health center is gone? When Typhoon Haiyan struck the Philippines on November 8th, nothing and no one was spared. 1 million homes and hundreds of health facilities were damaged or destroyed. 5 million people were left homeless. 200,000 pregnant women and teenage girls were affected. After any disaster, women continue to go into labor and give birth, no matter how inconvenient or dangerous the circumstances. UNFPA, the United Nations Population Fund, works to ensure the health and safety of displaced women who are pregnant or have very young babies, a vulnerable and often neglected group. In Giwan, eastern Samar, the typhoon knocked down the city's maternity hospital. Hospital chief Dr. Lilia Daganod started delivering babies and caring for patients at her home.
In there?
Yes, because there was no room in there. Normally, I delivered it here. I delivered that pregnant woman here. In here, in this area. I was very lucky. The normal process that we have for a normal delivery.
As soon as Giwan was accessible, UNFPA provided a delivery table and other equipment in response to Dr. Daganod's plea for help. In the town of Hernani, a huge storm surge wrecked the maternity center, a state-of-the-art facility that had opened in July. Local women were left without a proper place to deliver.
Most of the equipment has been inundated. Most are flooded and they're wet right now. All are electronic based, so we can't utilize them anymore.
In the days after the storm, Dr. Ezra Valido safely delivered 2 babies in the health center's lobby, in non-sterile conditions, with few supplies and using flashlights.
I actually use the examining table from my office to function like a delivery table right now. And think I had another one at home, but the baby died at home because it was a breech delivery. We were called too late. The baby was already dead when I came there. Had to deliver the baby on my own without any gloves, only with betadine solution on my hands. Had to do it bare hand.
Hernani was once a model for safe deliveries. No mother had died in childbirth in the past 5 years.
Before the typhoon, we're almost have a facility, increasing our facility-based deliveries. We have improved VHS, the RHUs with the full support of the UNFPA with the equipment, supplies. But after this typhoon, back to zero.
UNFPA is sending fresh supplies and equipment to help restore delivery services. But given the scale of the destruction and logistical challenges, restoration will take time. In the meantime, thousands of pregnant women who survived the typhoon may have to deliver at home without skilled help, at great risk to themselves and their babies. Dr. Valido worries that displaced women staying in destroyed coastal villages cannot get to the health facility, and he can't get to them, especially during the night.
We have 10% cesarean rate, so we have a lot of high-risk patients. So that would mean that if they would deliver at home without being attended by at least a health professional, they would be in high risk for mortalities. They could actually bleed out. They could actually have big lacerations after they deliver the baby, and no one would take care of them.
2 weeks after the typhoon, the rural health center in Mercedes was still not functional, so 20-year-old Marianne Ramanka gave birth in a relative's home. It was before dawn, and only her husband and mother-in-law assisted her. A midwife was sent for. She arrived just after the baby was born. If she'd had a way to get there, Marianne could have delivered in nearby Giwan. An NGO field hospital now provides childbirth services next to the wrecked hospital. Dr. Daguino continues to host new mothers at her home while they recover. Responding to the urgent needs, UNFPA is marshaling resources to help restore reproductive health services across the provinces affected by Haiyan. It has set up 3 offices to distribute clinical supplies and equipment to government and NGO partners providing services for women. UNFPA is also giving out kits for clean home deliveries and buckets packed with household hygiene items for displaced women and their families. In addition, UNFPA has mobilized youth volunteers to locate pregnant and breastfeeding survivors of Haiyan who need care and information. Mobile medical teams assembled by UNFPA are providing these women with prenatal exams and other services. The first teams visited crowded evacuation centers in Tacloban in Leyte province. Lovely Paredes, age 21, was 8 months into her third pregnancy when a tidal surge took her home and possessions. Concerned about her unborn child, she was relieved after getting a checkup.
Pag-examine na akon ang heartbeat na akon nga na heartbeat ang baby or problema nga ang akong baby healthy. Okay ang timbang, ang akong BP okay, wala problema.
Her pregnancy was too good. The baby was in good.
The doctor told Lovely that Tacloban has a functioning hospital where she can go to deliver. But she worries she won't be able to go because she can't leave her older daughter who has special needs. Many other pregnant survivors of Haiyan are in an even more precarious position, still without access to assisted delivery or emergency surgery.
We know that there are 900 deliveries a day occurring, and out of these, potentially almost 140 will have complications which may be life-threatening. So there is an urgent need, a dire need out there that we need to meet.
With national and international partners, UNFPA is ramping up its support for women and girls affected by Typhoon Haiyan, working to make safe childbirth an option for them once again.